And welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Today's guests have been on before separately, and there were so many questions we had to have them back on, and here they are together. If you watched the GI Health Summit, they were fan favorites. They are both physical therapists, pelvic floor physical therapists specifically. That's a mouthful. They work at Sarton Physical Therapy in Orange County. Their names are Dr. Julie Sarton and Dr. Mandy Menino. Please welcome them to the show. I love when you guys are together.
Thank you.
Thank you for having us again.
It's my pleasure. There's a live viewer, and I don't think it's you, named Mandy M, but I don't think you're watching it because you're doing this. So that's really funny.
Welcome, Mandy M.
So we have two Mandy M. So we're going to answer questions, and it takes a few minutes sometimes for the viewers to catch up with the feed. So while they're logging on, maybe you could just talk a little bit about what you do. What is pelvic floor physical therapy? Why is it so hush hush? Because really a lot of people, until you hear of it, it's like nobody talks about what goes on down there, and it's very important.
Yes.
Yeah, so when we look at pelvic floor physical therapy, like you said, it is a very taboo topic, which is kind of interesting because at some point in our lifespan, most of us have an issue with it. And so that's how a lot of us as PTs, we get into this kind of niche of physical therapy. Mine was postpartum and, had my own issues that I went through. So I think looking at that and just acknowledging it, how common it is, but yet it's not normal. And so I think what we hear a lot is, oh, it's common to have this problem postpartum, or it's common to have this problem because I'm getting older, or it's common, whatever that next kind of word is. And what we're here to say is, they say it's normal. We say it's not normal, it's common, right? And so we just want to kind of break through and say, these things are common, but they're not normal, and we're here to help you. And then when we look at the pelvic floor, here's our pelvic model. What a lot of people don't even realize is the pelvic floor, they're muscles, just like we have our bicep muscles, our hamstrings, all of those, but they're obviously in a little bit more of a sensitive place. And so it becomes this very taboo topic. But when we're looking at the pelvic floor here, it's this group of muscles that sit around. This is a female pelvis. So we have the urethra, the vaginal opening, and then the rectum. And so then we have our pelvic floor muscles that sit all around. And from this view, you can see both the external, and then these are getting into our levator ani muscles. And so it's going to have a huge impact on our bladder, on our bowel movements, and on sexual function. And so that's what we really specialize in, and why patients and our friends and family come to talk to us about these issues.
And we're so excited, Chef AJ, because you're right that this is so under-addressed, under-discussed, right? It's taboo. It should not be taboo, right? So I always say all roads lead to the pelvis, right? Eventually. I mean, it is at the core of our body. It's one of our inner core muscles. And so, people are like, pelvic floor, well, what's it for? And Mandy just touched on that beautifully, right? So we have these 4 functions, really 5 functions, right? So these muscles help keep us continent, right? They help with the sphincters closing so that we don't pee in our pants and accidentally have, any fecal loss too. They help hold up all our organs, so they have a supportive function. They fire with every single step we take, working with our abdominal muscles, our low back muscles, so they're part of our inner core, right? And then there's a sexual functioning role too that most people don't realize. And these muscles need to be both lengthened and strengthened so that we can have great sex.
Wow, there's a lot going on down there for sure.
There is. Yes.
It just seems that I know very few people, especially women as they get older, that don't have some kind of problem down there, whether it is painful sex, incontinence. And is there a way we can just avoid this as we age?
So, that brings up a great point, because I think we touched on this last time when we were on, but I would so love to see this as not just standard of care, but flip the switch and say, hey, can we be preventative instead of chasing the problem once it happens? Because it is quite common, right? At some point in our life, we're probably going to experience some kind of pelvic floor dysfunction, regardless of what realm that's in. So could we I know it's terrible. I said this last time, like we go to the dentist and you're like, don't use that analogy, right? Who wants to go to the dentist? But I'm like, could we, think about having every woman and actually man, because men have pelvic floors too, come in at least once a year for screening, right? I mean, it's a big trend that we talk about too in pre and postpartum care. Let's not wait again. Let's get every woman who's pregnant in for pelvic floor PT. Let's get every woman going through menopause in for an exam with pelvic PT. See what's happening with the muscles, right? Let's get every pelvic surgical patient, regardless of what the surgery is, in for some prehab, and let's address the pelvic floor musculature, set you up for better success with surgery. And then after, same thing. So, other countries have pelvic PT as standard of care. Again, just like, we mentioned previously in France, every woman, the second that she's pregnant, gets sent to pelvic PT for, somewhere between 8 and 12 visits. It's just what happens. So.
And I think really I want to mention Chef AJ is, so when we look at low back pain, how many people, I think every one of our viewers right now could say they know someone with low back pain, right? So there was a study done in 2018 that showed 95% of women that have low back pain also have pelvic floor dysfunction. So I think we're missing a huge group of people. They're getting referred to the typical outpatient orthopedic for their back pain, and they're getting some improvement, but maybe just can't quite figure out what that missing link is. And so I think, especially because I came from that background of that ortho world, that I just look back and think how many people are probably being missed that have a pelvic floor dysfunction that's also playing into their back pain.
Yeah. Kylie says, well, will doing Pilates help, and how much would a person have to do?
Yeah, so we actually work very closely. We have a Pilates trainer here on site that we work very closely with, looking at trying to improve the diaphragmatic breathing, just the overall breath system, core musculature, making sure that we're firing and recruiting muscles correctly. Because when we look at the core system, at the top, we have our diaphragm, the bottom's the pelvic floor, and then in the front deep, we have what's called the transverse abdominis, and then in the back of that core system is the multifidi, so some tiny little muscles that connect along the spine. So we want to make sure that system is working efficiently. Anytime it's not working efficiently, it can increase your intra-abdominal pressure, meaning that pressure here in your abdomen. And if that pressure is increased, it's going to essentially put that extra pressure where the weakest link is. So for some, it's their pelvic floor. It starts leading to pelvic floor dysfunction. So yes, absolutely, we would want to be working with a trained Pilates instructor along your journey.
And I would just add to that too, that when you do work with a Pilates instructor, ask them what their experience is with pelvic floor dysfunction, because not everyone understands that component. And if you are struggling with one of the issues that we're talking about, then get yoked up with your Pilates instructor and a pelvic PT together.
Great. So many people said they saw you on the GI Health Summit and that you were very informative and helpful, and they appreciate you being back again. Dwin says, help, my pelvis has fallen and it's almost like it's coming out.
Yes, another issue. So pelvic organ prolapse. You can have either the uterus, you can have the bladder or the rectum that can descend. And there are various degrees of prolapse, which just means, like she said, it feels like it's falling out. So typically what you want to do is you want to make sure you are seen both by a pelvic PT and an MD, such as a urogynecologist, OB-GYN, or urologist. And then we go after strengthening the pelvic floor, that function, right, of stability to help hold up all the organs. So there's a lot you can do in terms of we teach the patient to be her own therapist, to really integrate not just pelvic floor strengthening, but all the core musculature that Mandy just talked about too, to help, again, the stability of those organs.
Yeah,
nice.
Something I know when I had looked back at some of the notes in the talk that I had given a while back, Chef AJ, there was a viewer that had asked about pessaries and, are they helpful? So in cases where the pelvic organ prolapse is actually coming out of the vaginal opening. We can work with a MD to get a pessary. We do not fit or make those. That's something that the doctor would do, but we'll work with our patients with those pessaries. And then again, the big thing is the strength and stability, but also teaching them how to better maintain a better intra-abdominal pressure so they aren't putting all this excessive strain on their pelvic organs, which are then causing them and contributing to them prolapsing out. Yeah.
So Carolyn asks, is it possible to prevent hemorrhoids from occurring when giving birth to a baby? Do other species have this? Like you never hear about dogs. I mean, I've never heard of like dogs or cats having pelvic floor dysfunction or hemorrhoids or.
You know, it's so interesting you say that because my family were looking at adopting, we want to have a therapy dog actually to come into the clinic. And one of the dogs I was looking at was being rehabbed for a prolapse. So it is possible after,
Oh my, who knew? Who knew?
Give birth, they can actually have uterine prolapse. So yeah, it is possible.
Well, do they have
that answer, Chef AJ?
You know, it's funny because when my dog Ginger had a TPLO replacement, she went to a physical therapist just for canines. I wonder if they have pelvic floor canine physical therapists. I don't know how you're going to get the dogs to do the biofeedback.
Next on your show.
I would love it. I would love it. Oh my God, that'd be amazing. Do you do that biofeedback thing, that thing where they hook the electrodes to you? Do you know what I'm talking about? Because I've had this kind of therapy once. I forget what it's called, but they put like little things on you and they watch the thing.
Right. And then you can either have electrodes externally around either the vaginal or rectal opening and the perineum, or you can use a probe that is inserted internally. So biofeedback's a little controversial in my opinion. So I've been around for a while, for about 24 years. I have some strong feelings about it. I don't think it's the best, honestly, I think avenue for treatment because, and I've used it plenty in the past, but a patient can actually quote cheat, right? The electrical output of the pelvic floor is measured, but we don't know if the pelvic floor is being engaged correctly. So a patient could do a quote Kegel incorrectly and bear down, and there's still recruitment of the pelvic floor, but the pressures that Mandy was just talking about, the intra-abdominal pressure isn't being utilized correctly. So, but it can look like on the computer that you're doing just a perfect job, right? Activating your pelvic floor. So we use in this clinic, we call it manual biofeedback because there is nothing like human touch. We glove up with our hands. We actually feel what's happening with the pelvic floor. We look to see, is the pelvic floor being recruited appropriately? So for example, with a Kegel, there's two parts to that, right? So there's a squeeze and there's a lift and an elevation. So a lot of people can get the squeeze, but then they'll bear down. So, and bringing you back to Pilates, like I had a patient once who is a great Pilates instructor and I'm all, oh my gosh, I had her on the table. Why don't you go ahead and do a Kegel for me? I'm like, you're going to be an expert at this, right? So she Kegels and I'm palpating her pelvic floor. And that's what happened. She squeezed and boom, pushed down. And I was all, oh, can you do it again? So she did it and she pushed down. And it was just an aha moment for me because I'm like, oh my gosh. And I was like, oh, okay, we need to correct this. And I'm like, are you teaching your patients or clients to do that, right? And in her brain, proprioceptively, she didn't realize she was doing this. She thought she was doing this. So yes, biofeedback is good. Machine versus hands, I always say, manual biofeedback is truly the best. And so I have abandoned. We have a biofeedback machine here. It stays in the back closet all the time because, because I don't feel it's as effective.
So that's possible that a lot of people are doing their Kegels incorrectly.
Yes, and we see that a lot. Typically, when I first evaluate someone's pelvic floor strength, muscle strength, I'll just ask them, go ahead and do a Kegel how you think you're supposed to do it. Because I don't want to lead them into it. I want to see what they think, is correct. And oftentimes it is incorrect. And so it takes time. And like Julie said, that using a digital manual biofeedback is really critical. And then we're able to really know what they're recruiting, what muscles they're firing, and then we can better teach them and we can physically feel if they're able to then do it.
Nice. So another Mandy says, would you recommend working on your pelvic floor muscles if somebody is feeling like they need to pee all the time, possibly due to stress?
Yes, absolutely. So that's the last part of that statement is very important too when you talk about stress. So when we look at the pelvic floor and how it functions, so when we look at the pelvic floor, it's driven by the autonomic nervous system. And so that is broken down then into two systems, looking at the sympathetic and parasympathetic. So when we hear the sympathetic, that is our very stress, right? That's like, the bear's coming, let's run, let's get away. We're here, we're running away. The parasympathetic is our very rest and digest. That's where we're kind of healing. We're in that meditation, that calming Zen type of activity. So if we're constantly, whether it's a stressful job, whether it's a lot of stress at home, whether it's this kind of crazy world we're living in that's bringing extra stress to many people, a lot of that can lead to what we call a hypertonic or a lot of tightness of the pelvic floor. Now, why that really matters is if, say, for example, I'm holding my fist in a hand, or my hand in a fist for a prolonged period of time, say 10 minutes, or, and then it goes on to hours and hours and days and months, and then years of kind of this tightness, this tone. You're going to see my knuckles start to go white, right? They're not getting good blood supply. They're not having this normal blood flow going on. And so when you look at that, then in relationship to the pelvic floor, if these muscles here are constantly in this very tight, well, they're putting pressure on our urethra, on our vaginal opening, on our rectal opening. And so, yes, absolutely can lead to increased urinary urgency, increased frequency of urination. And so a very common reason we see people, and we talk a lot about that stress and kind of down training. So looking at adding in a little bit of a meditation, a little bit of that diaphragmatic breathing to try to get us in a more calming state versus this constant like, what's happening, in our lives.
And just to build on that, so make your fist, because that was an awesome analogy. So if I'm a structure running through, right, this tight muscle like this, so whether I'm a urethra right here, I'm a nerve, the main nerve of the pelvis is the pudendal nerve. If I am the rectum, right, sitting right through here in the anal canal. So if these muscles are too hypertonic, right, there are going to be issues. So down regulating, like Mandy said, the nervous system is critical. And then we go in, we glove up, and we actually manually take these muscles and we lengthen them back out so that they are super happy and they get all their blood flow, oxygen, nutrients that they should get.
Great. Thank you. Jamie says, I'm having burning during intercourse. I pee a little while rebounding. She's thinking rebounding might help this pain during sex.
So
rebounding is like when you jump on a mini trampoline.
Oh, got it. Okay, yeah. Got it. Okay. Okay. So maybe. So it all depends, right? So I wish I could say an absolute yes or no. It really depends on what the state of the muscles are doing. So it's got to come back to, again, getting the right assessment, because if you take a muscle that's already tight and you rebound and you jump, it's probably going to make it even shorter and tighter, which could in turn create more compression on the main nerve that innervates the pelvis, more burning than with sex. So a precursor to that, if that is happening, is the muscles need to lengthen. You need to learn how to lengthen, open up your pelvic floor. There's some key stretches, breathing, manual techniques you use. And then, yes, eventually rebounding could be good as you enter into the strengthening phase of rehab.
Yeah, and I think right now would be a good time just to mention, Chef AJ. So what we hear a lot and what a lot of patients come to us and say is, oh, well, I've been working on my Kegels, or my doctor said do Kegels. And so when we're looking at these issues where we talk about things are really tight already, if we're taking an already tight muscle and then trying to strengthen it further, we're causing more harm than good. Yep. So
there's nowhere left to go, right? If my bicep is already, if I walk around with my bicep contracted like this in a chronic shortened state, and I want to strengthen my bicep, we're not going to strengthen it. So it's exactly what Mandy said. So yeah, we need to lengthen.
Yeah. And I think this is something, I see quite a lot. And myself, I was told to start doing Kegels postpartum. And for me, that would have been the worst thing I could have done. And so I think that's why it is really critical to have an actual pelvic floor assessment by a trained skilled pelvic floor physical therapist. So that way, you know, what does your tissue, what do your muscles actually feel like versus trying to guess. And obviously we've seen a lot. We know kind of the tendencies of where they run, but nothing beats an internal pelvic floor assessment.
Terrific. So here is a question from Patty. She says, I've heard that doing sit-ups is actually bad for the pelvic floor. Is that correct?
Do you want to take that one?
Yeah, so when we look at sit-ups, the big thing that I'm looking at and I'm concerned about, again, is that intra-abdominal pressure. So if somebody doing a sit-up is not necessarily a bad exercise. And I think that it's gotten a lot of bad attention in the past, just saying, oh, don't ever do a sit-up, again. But if you are able to properly do a sit-up and properly cue your muscles and you recruit them appropriately, then yes, you can do sit-ups again. But I think the number of people that are able to do that, and if they have a pelvic floor dysfunction, they're probably even less likely to be able to do that initially. But if that's a goal that they have, it's something they want to talk to their provider about and, work on a plan to get them there.
Great. Karen is saying that pelvic floor PT during pregnancy would have been wonderful. Yes. So here's a question on, here it is from Dean. I will be having hemorrhoid surgery soon. Should I consider a screening prior to surgery?
Yes, absolutely. Again, before any surgery, pelvic surgery would be ideal to see a pelvic floor PT. Because the healthier your pelvic floor muscles are, the fascia, all the connective tissue around that region, the healthier that is, the more successful you're going to, the more success you'll have with your surgery, and less likely that you'll flare after your surgery too with pain.
Yeah. Is this something that anyone could just they have your phone number in the show notes, can they just come in, or does it have to be ordered by a doctor? And if so, what kind of doctor? And is this something that insurance generally will pay for?
Yeah, so in the state of California, we have what's called direct access. So patients can come directly to us initially without needing any kind of referral from their doctor. So that's something that, we offer telehealth appointments for those not local. We do have an out of town program also for anyone wanting to travel in to see us. And then we, serve our local area and community here.
That's great.
And insurance does usually pay, right? Because we're physical therapists. This is a niche practice, specialized area of PT. So it depends on every individual practice and how they're set up. But yes, most insurances will obviously cover PT. So yeah.
Nice. Gina says, if I have to pee a half hour after I drink a glass of water, do I need pelvic floor treatment?
Yes, so it's definitely something that you would want to see either a urogynecologist, urologist, and start having that conversation and coming to see a pelvic floor physical therapist. So whenever, you're talking about having to go to the bathroom pretty right away after drinking something or shortly after, we want to look at just your overall voiding schedule and what that looks like. If somebody is going to the bathroom very frequently, we want to know if they're completely voiding or completely emptying whenever they're going to the bathroom versus are they having any residual remaining. So we test that looking at a post-residual void test, which is done at the doctor's office. Versus us here, and they'll look and see if there is some lingering urine that's in there, or is it just something where we're getting these frequent urgencies and then we need to talk about urge suppression techniques and then looking at the integrity of the muscle and treating it appropriately.
And I think I'd add to that too, is that normal voiding should be somewhere between 4 and 7 times a day. So if that person is peeing more frequently throughout the day, yes. If she's getting up more than once a night, yes. Then you then head over and find a pelvic PT and who's yoked with a good doctor.
Right, because Linda said, I'm awake several times a night, I have to pee. Is that pelvic floor weakness?
So so again, weakness, or actually the opposite. It could be that the muscles are actually too hypertonic. So remember that concept we talked about, right? So then if you're not emptying completely, you're going to have to go more frequently. So the treatment would be different then. Still, you need to see a pelvic PT, just different what happens once you're in our office.
People that get chronic UTIs, is there anything you guys can do for them?
Yeah, so the first thing we want to know is, are they confirmed UTIs that they've actually had cultures, or are they just suspected UTIs? Because that's something we see very, very often. Our patients say, I got a culture, they're always negative, but I feel like I always have a UTI. And then we're looking more at the pelvic floor and looking at the hypertonicity, or that really tightness that's then leading and contributing to their symptoms. And so when we're looking at those symptoms too, we spend a lot of time looking also at the surrounding structure. So looking at the abdomen, that fascial component that's also feeding into it, looking at the inner thighs, those adductors and their close relationship and connection to the pelvic floor. So it's not just, we don't just treat the muscles of the pelvic floor. We are looking at the supporting structures around it and making sure we're working as a system and we're all working together versus everything trying to do its own thing. And then we end up with these issues.
So you have over 30 muscles that attach on the pelvic girdle. Like that's an insane amount of musculature, right? So for example, we just had a male patient who came in and he presented with urinary urgency frequency. He was going like, up to 15 times a day, waking up 4 times a night. He got diagnosed with prostatitis. He had been on 1.5 years worth of antibiotics, which is terrible because he never had an infection. It was not a problem with the prostate. The prostate was the victim. It was all his muscles. And it was fascinating because when I did his exam, we went in through all these muscles through the abdominal wall. And as I palpated in here, I reproduced his urge to pee. Because as Mandy said, right, the pelvic floor doesn't work in isolation. So you can get these referral patterns with these other muscles too. So his pelvic floor, when we palpated, it reproduced his urge to pee, and so did his abs. So just another good story to remember that good medicine, get your cultures and make sure you check and don't go on antibiotics unnecessarily. And then look with a wider lens with what's happening.
Right. So this is a more specific question from Susan on rebounding. Can rebounding actually hurt the pelvic floor? Rebounding exercises.
Yeah. So I like rebounding in general because I think once the pelvic floor is in a healthy state, right, it helps load to explode the pelvic floor, right? So, and those muscles should react, right? When we jump, when we exercise, when we move. So I think it's a great activity and exercise. I just think, again, that missing piece right before then would be, what is the state of your pelvic floor musculature? And if it's a little hypertonic, let's get it healthy. And then you get to rebound. Awesome, right? Because then we take that bicep muscle and we're going to take it through, or that pelvic floor muscle through full range. And then we're going to bring it back and we're going to get it to experience like this increased load with bouncing.
What about people that have incontinence, but it's at night and they're sleeping and they don't wake up? I mean, until the morning and they're,
And then they leak if they have an issue.
Or actually they completely pee, but they don't know, they didn't wake up.
Yeah. So that then becomes another layer that we need to investigate with a physician, right? Because the sensory awareness on the brain, what we call the proprioception, is absent, right? So that signal should be waking us up enough to like alert us. Okay, got to get up and go to the bathroom. If that's absent, then we need some further testing done with a very skilled urogynecologist, urologist, to see what's happening and why did that signal get lost.
Nice, great. Let's see. Oh, JL says that on a veterinarian show by Dr. Coy, they showed that cows and pigs have prolapses. So,
see?
But I'm guessing it was the female. I bet it's the female ones though that gave birth. Wouldn't you? I would guess. Yeah.
Yes, but men can get prolapse too. We've had several men in our practice who ended up with rectal prolapse. And why do you think that happens? It's back to that intra-abdominal pressure. So a few of them, they did very heavy weightlifting, right? But they didn't control the forces coming down. So you hammer this, right? And if you don't have appropriate strategy, then the rectum can actually bulge out of the external anal sphincter.
Wow. Wow. Suzette says, can specific exercises cure incontinence completely at 60?
Yeah, we see, it varies obviously patient to patient, but yeah, we have great success with our patients who suffer from incontinence. Some, it may be a new onset. A newer onset is typically a little bit easier or quicker to treat versus someone that's struggled with incontinence for years. The longer it's been going on, those muscles have more of a memory of, not working or functioning in a correct manner. But to say someone at 60 should be incontinent, no, there's definitely working with a pelvic physical therapist, I absolutely would see improvement, if not complete success. And again, it varies depending on why is the issue happening in the first place.
So, and I'll add, Chef EJ, just because you and I were talking about this before we went live, just about hormones and, once you hit menopause. So as estrogen decreases, the tissues within the vulvar region and even around the urethra will be affected, right? So estrogen is a vasodilator. And what that means is it brings blood flow into tissues. It plumps those tissues up. So even the tissue health of our musculature changes as we age. So is somebody at age 60 going to have a little bit more of a challenge than somebody, say, at age 30? Yes. That's where we work. Doesn't mean it doesn't work, right? It just means like, okay, in addition to pelvic floor strengthening and pelvic floor physical therapy, then we're going to, again, work really closely with a good doctor who understands hormones. And let's look at that aspect as well. And maybe some hormones and estrogen in there is going to actually help plump up that tissue. So your exercise program now is so much more effective.
I think I'm vegan, plant-based for 43 years, and so many of the vegan doctors, like, they tell the vegan population not to go on estrace because of the risk of cancer and stuff. But I've heard from urologists that it does something not just with sexual function, but with the whole urinary. It's maybe you can explain what it does for people that choose to go on it.
So yeah, it is a you hit the nail on the head because it's very controversial. And I will say I'm not an expert on this topic. And I would refer you to a great physician who is, but I will tell you all the studies and the scares that happened around estrogen and cancer, were a little bit, we can't generalize, not that they were blown out of proportion, but kind of, because it was one very specific type of estrogen that they were looking at. And so, a lot of blanket statements came out regarding this. So what estrogen does, again, is because it is a vasodilator, it makes these tissues, quote, thicker and healthier. So I like to say, like, for example, you could take a pelvic floor that looks like this, right? That's really thin. The muscle is really thin. And this could be a 70-year-old right here who's lacking estrogen versus, let's see what we'll take, something thick like this, right? With a 30-year-old that has more estrogen. So it's plumper, it's just healthier. So, yeah, it's very individualistic. Obviously, if there is a history of cancer, then you need to have a good consult with a good physician about whether estrogen is, vaginal. I'm not talking systemic, just vaginal estrogen is a good part of your plan of care. So yeah, and I think, again, we can't generalize because systemic estrogen different than vaginal estrogen. But when we're talking about pelvic floor issues and vulvar, like here's our vulva right here, right? Vulvar tissue health, there are very specific parts of your anatomy that are dependent on both estrogen and testosterone. And as we age, unfortunately, we start to lose that, not just the estrogen, but the testosterone as well.
So when women, as they get older and find sex painful, is that because of the decrease in estrogen primarily?
So it can be. That can be absolutely one factor. Again, not a blanket statement, not for everybody. So it's usually, almost all these issues are multifactorial, right? So it can be, wow, we have a shift in hormones and the structures aren't, the integrity of the structures are a little bit impaired because of that. B, the muscles, right, can be impaired. The minute our brain perceives pain, what do our pelvic floor muscles do? They're going to guard and protect. So, right. So even if you go, well, I'm going to get on some vaginal estrogen, right? So whether that is estrase, Premarin, bioidentical, right, compounded, whatever it is, that's not enough, because if we've set up that pattern now of the muscles tightening and guarding and protecting, You can have all the estrogen in the world, but you go to have, sex, and those muscles are stuck in this contractured position, and that's going to create pain. So combination, usually what we call multimodal treatment is required.
And then also loss of libido occurs often too.
Correct. Because as our testosterone's dropping, right? So that's the one that gives us a lot of drive.
So I have a torn rotator cuff, and I got 12 physical therapy appointments, and then I was sent home on my own recognizance, but told I've got to keep doing it. And so with pelvic floor physical therapy, is it a one and done, or do we go many times, one time, or is it something we have to continue for the rest of our lives?
Yeah, it really varies on each case. Each case is unique, but our number one goal is that we want to teach our patients how to be the CEO of their own body. We want to teach them the tools that they need to then be successful, as the months, years go on. And so for some of our patients, they may have that little check-in every couple months and say, hey, I just want to, get a quick assessment. How am I doing? Other patients say, hey, I know when something's kind of sneaking up on me, and I notice, I better get my toolbox out, and start working on those exercises you showed me, any use of a dilator or a pelvic wand, or kind of honing back in on those meditation and those relaxation techniques. And so that's ultimately our goal, is that we want patients to be independent and not rely on us forever. But if they need us, we are always here to, give them that check-in and get them back on track.
I wish, you guys are the ones that told me about the squatty potty, which is a complete game changer for anyone that poops, even if they think they poop great. Do you have like a squatty potty equivalent for other types of pelvic floor dysfunction? That would be amazing if you had like something like that.
Yeah, there's all sorts of great tools, that are out there for people that suffer. So here's an example of another little tool that we actually.
Oh, that looks painful. I got to tell you, if that's going where I think it's going.
You don't want it to be scary. Actually, you can use the smaller end right here, but this can be used, for example, we teach women and men, believe it or not, too. So for example, if you have pain with sex because these muscles are too tight right through here, right? Then you get to learn how to self-treat with this pelvic wand going in, and you can actually learn how to, let me see if I can show a sample, get in and release what we call trigger points, taut bands within the muscles to lengthen out those muscles, right? So yes, this is another little tool. There are, I think you mentioned too, it sounds like you had some dilators too, right?
Oh my God, that's just, who thinks of these things, right?
So again, this would be a great way to, if you have pain with sex and it's because these muscles are too tight, then you gently insert right in through here, and these muscles slowly get elongated. I always tell patients it's like doing a hamstring stretch, right? And so you gently help those muscles stretch and become elongated into a happy state. That's needed, obviously, when having penetrative sex.
Wow. Oh my God.
One of the questions in the past, Chef AJ, was what kind of lubricants do we recommend?
Yeah, absolutely. Because some of them have something in it. You said that, was it you that said, or somebody said there's some ingredients in some of them that are not good for us.
Yeah. So what we use here in the clinic is slippery stuff. Some other brands are like Uber Lube, Almost Naked. Those are all just nice, clean, natural products versus, the ones that you typically see on the shelves at your Target.
KY gel, especially with warming agents, right? And the more chemicals you have, the more you should stay away. Propylene glycol is an irritant and will cause burning, and it is in a lot of different lubricants. So just flip over and read labels. And
what's the one you said you use? Slippery something?
Stuff.
Yes.
Yep.
Wait, slippery?
One.
Yep.
Yeah.
So
Let's see it.
here, slippery stuff it's a water-based lubricant. Desert Harvest. This is an aloe vera gel that can be used as well, which is really nice too, especially if there's an inflammatory component going on. And then we actually also use something called emu oil. And this is 100% natural and organic, and very great for an inflammatory component as well.
What about coconut oil?
Yes.
Yes, you can use coconut oil also.
Coconut oil, olive oil, right?
Oh my gosh. Okay.
Avocado.
Yeah. That's so interesting. So Carolyn says, why do I occasionally pee myself only when I wear tampons? What mechanically is the tampon doing to cause that?
Interesting. Okay. So leaking with tampon use. Well, we would have to do an exam and look. So that's a great question because I would think it would be the opposite usually. So mechanically then my guess is that there's going to be some kind of shift with what's happening with the positioning of her organs, with your organs. So whether bladder or the urethra has gently prolapsed a little bit, we need to do a pelvic exam and figure out and see like, okay, what's off here? Because obviously when you use a tampon, it's going to create a little bit of pressure on the anterior, what we call the anterior wall that helps support the bladder and the urethra. So yeah. You have any other?
Right, and you can't do an examination with telemedicine.
We do. So we do see a lot of people with telemedicine. You're right. Obviously, we can't get our hands on a patient, but there's so much that we can do. I mean, and we actually, I mean, I have patients get on the table and I look at their anatomy as best as I can. We look at posture. We look and see what, is happening externally. We have them take pictures and send so we can see, and we do as much education as we can and self-treatment. We teach self-treatment, but at the end of the day, yes, we need to get our hands on patients and then teach them how to treat themselves.
Great. So Linda says, will pelvic floor physical therapy help me with so much pain that I cannot be examined vaginally without sedation? Forget intercourse. I've had a hysterectomy 10 years ago.
Yeah, so we do see many patients that come and they're not able to tolerate or they're don't even want to attempt to try an internal pelvic exam. And so that's something that we work with them. There's a lot we can start with externally, looking again at the abdomen, that intercourse system, looking at external pelvic floor musculature, looking at the hips, the flexibility of the adductors, hamstrings, looking at the external musculature. So there is a lot that we can start with, and we do with many of our patients that aren't able to tolerate that initially. And then we can also work with a physician to get different, looking at different creams as far as to help with like a lidocaine type of cream to then progress and try to work on some internal pelvic muscles as they're able to tolerate and as they're wanting to progress to that.
And just like you would take a muscle relaxant orally, you can actually use suppository form of muscle relaxants that can help relax the pelvic floor musculature. In some of our really severe cases in patients who have significant pain, they will use this routinely for, a month or so to help break that spasm cycle. And sometimes they'll use it before treatment, sometimes to take that edge off. So we have a little bit more of an opportunity to get in to start working with those muscles on the inside. But as Mandy said, there's so much you can do on the outside to bias the inside.
Wow. Thank you. Here's a question from Amanda. I've had both an endoscopy and colonoscopy. I've also seen a urogyno and gyno. They have all said everything feels fine. However, I feel a bulging sensation occasionally. Any ideas? I'm not sure where that bulging sensation is. So.
Yeah. Well, okay. So one thing that is important to note is that most physicians are trained organ-based, right? So they're looking at the organs, but they're missing the musculature because they're not trained in medical school. It's no fault of their own. They just don't get this training. So I have a physician patient right now, and she's about my age. She's all, Julie, do you want to know what I got in med school on the pelvic floor? She brings me in 2 paragraphs from an old textbook, right? She's like, this is what I got. And so like with her, she had a really severe pelvic pain syndrome called pudendal neuralgia. She even, her own OB-GYN missed. So let me not tangent too far away and go back to the question. This is what I always do. Sorry. So that bulge sensation could be muscle because you can get this mirroring of this like, oh, I have this bulge sensation, or it could be potentially prolapse. My question back would be, did your physician, your urogynecologist actually assess you in standing? Right? A, did that doctor look at your pelvic floor muscles? B, did that urogyne do an internal exam in standing and feel what happens when gravity comes down? And do you have prolapse? It's either going to be a prolapse or a muscle dysfunction.
Great, thank you. And let's see. This is from Angela. I had a C-section 9 years ago, and for a couple of years, I experienced pain in the lower right side of my abdomen. It went away over time, but when my bowels move slow, I get that ache. Is that scarring?
Yeah, so to say if it's definitely scarring or if it's fascial restrictions, there's something restricted going on there. And so I'm a C-section mama of 2. And one of the biggest things that I think we're missing for our postpartum moms is talking about scar mobilization. And so looking at, it's never too late to work on your scar and the tissue around it. And so just getting in and trying to move that tissue, the scar is made to move. It should not be tacked down, because when it's tacked down, that then sits over your essentially over your bladder, and then looking at the layers beneath. And so getting in and moving and mobilizing the scar. And then also when we think about constipation, if there's any kind of restriction going through, coming from, the ascending to the transverse, descending sigmoid colon, then we're going to have an issue with getting having a bowel movement. And so really getting that all moving, if there are fascial restrictions, it's not going to be moving through the system efficiently like we would want it to.
Great. So here's a question from Karen. What is your opinion on the medication oxybutynin? Should I be trying pelvic exercises instead of meds?
So there was an older study that they did, and they looked at meds for urge incontinence alone versus pelvic floor PT or pelvic rehab versus the 2 together. And really the 2 together did yield the best result. So if you're already on that medication and you're getting some results with it, then I would pair it with the pelvic PT to take you to a new level instead of doing something in isolation. If you haven't started on meds, my first go-to would be absolutely start with pelvic PT first, because if you can get it naturally, awesome, right? We don't want to necessarily be on meds that we don't have to be. Some people do require meds, and it's not a bad thing. So I would layer pelvic PT in on top of it. And then if you're successful for a long period of time, see if you can pull back from the medication.
Great. So Patty says, how do you stretch pelvic floor muscles, and how do you find a pelvic floor physical therapist?
Yeah, so when we talk about stretching the pelvic floor muscles, again, we can use like our wand or our dilators, or when you're seeing a pelvic floor physical therapist, looking at that single digit gloved kind of trigger point muscle release. The other thing that we teach patients is how to do a pelvic floor elongation, so instead of being tight here, we're going to teach them how to elongate those pelvic floor muscles to get some more length. So those are the big things as far as getting some lengthening component. As far as finding a pelvic PT, there are a couple of resources that are online that pelvic PTs can be registered through. So there's a resource, Pelvic Rehab, Pelvic Guru, and then the American Physical Therapy Association. They also have a link. So it's the APTA that you can search for pelvic floor physical therapist, either by name or in a city or region that you live in the US.
And you can just Google too, right, like in your city, right? Pelvic floor physical therapy near me or whatever, and see what comes up and do your research, because you want to see not all pelvic PTs specialize in all types of dysfunctions, right? So there's niches within the niche. And then to add to what Mandy said is that there are quite a few stretches and yoga positions as well that will really elongate the pelvic floor beautifully. So go back, because I think on our combined one, or definitely in the summit, we did show a few examples of those stretches. Or you can, hop on over to Instagram. We put all sorts of stuff. It's pelvic healing on Instagram, and we have all sorts of stretches and exercises and self techniques and tricks that you can learn to self-treat.
Yes. Nice. Okay. Is this a chat for women only? No, because men have you were saying men have a pelvic floor too, right?
Can we please have a question from a male? We love it.
Absolutely. So Cal, if you have a question, we would love it from you. It says, do you know what would help rectal spasms?
Yeah, yes, absolutely. So all the stuff that we've been talking about, right? So usually rectal spasm is because the muscle right through there. So we're going to show you right through here. So here's the external anal sphincter right here. And do you see this sling of muscle? This is called your puborectalis. We have all these other muscles that come around here. So if these muscles do this and they become too hypertonic, too overly active, then that's going to create pain and, quote, spasm. So everything we've been talking about, right? So even this wand can be used gently rectally to stretch, right? Learning how to do proper breathing, diaphragmatic breathing. When the diaphragm drops, the whole pelvic floor drops. There's a pressure relationship between the two. If we're stressed, we're using our accessory breathing muscles, diaphragm's pulled up, pelvic floor is pulled up. So, the things that Mandy mentioned, right? Getting into the parasympathetic state, rest and digest, seeing a pelvic PT, learning how to self-treat to lengthen those muscles. Think about, again, all the external muscles, our hamstrings coming right up through here, even lengthening the hamstring can influence right through here, lengthening our hip flexors, our inner thigh muscles. There's all of these other external muscles. So it's a combination, but that can absolutely be helped. We see a lot of women and men with rectal muscle spasm and rectal pain.
Nice. Reba says, it seems like I retain a lot of urine, always feel like I have to pee. And then again, all negative on infection, no pain or burning, have a lot of leakage, especially have to get up at night and pee. This is so common and nobody's talking about it except you guys.
I'm so glad you're talking to us about it. Yes. Yes. ASAP, go find your pelvic PT, right? And if there's not one, we can start with a telehealth session with you because likely you have pelvic floor hypertonicity or muscle spasm. So again, think of, right, that urethra being able to expand, the bladder neck dropping down so that we can empty completely. And if we don't empty completely, we're going to have to pee more often. And the bladder is smooth muscle, and the bladder will get used to having maybe only like 200 cc's, and then it goes, oh, time to empty, right? So you have to be careful and not feed into what's called an abnormal or false urge. So we do a lot of bladder re-education training when patients come in too, and you can change that bladder as well, right? The smooth muscle, that bladder can actually learn how to expand and then not be as sensitive so that it has 600 cc's before we're going to empty.
Nice. Gina says, what do we say to our internists for them to refer us to a pelvic floor PT? I found that it seems like the gynecologists and the urologists seem to know, not the internists don't know, but it seems like those two specialties really know.
Yeah. And I mean, most providers, if you're going to have the conversation with them and let them know like, hey, I think I have pelvic floor dysfunction, or these are my symptoms. This is why I think I should go to pelvic floor physical therapy. Most are pretty open to referring. And then again, check with your state, see if you need a referral, because a lot of states have direct access that you can go directly to your physical therapist without a doctor's referral.
Great. Lily says, would you recommend jade egg or yoni egg to strengthen? I don't even know what that is. I'm vegan.
Out, Chef AJ. Yes. Well, so again, it can be a really nice adjunct, but we want to make sure that the health of the pelvic floor, that you're in a normal, healthy, resting state before you're going to use that. So we always need to know that the pelvic floor, before we strengthen, is lengthened. So eventually, yes. And it depends on where your pelvic floor muscles are starting from.
Oh. So Cal, who is a man, thank you very much, is
Yay.
asking, I mean, assuming he is, that's my friend Cal, what are the benefits of a healthy pelvic floor for a male?
Great question. Awesome.
Yeah, so when we look at a healthy pelvic floor, we need a healthy pelvic floor for everything to be functioning correctly, right? So if we have any abnormality in our pelvic floor, then we may be having bladder dysfunction. We may be having some kind of constipation or, motility issue there, maybe having some kind of sexual dysfunction. So if you're noticing you're having any kind of abnormality, and then I want to pull back again, back pain. Just because the study came out, it was only for females. I mean, you can't tell me that of men, if they did the same study on men, I would expect the number to be relatively similar. So if you're having any of those issues, then I absolutely would encourage you to see a pelvic floor physical therapist.
And we think about,
No, I was just going to, because Kelsey, what are the exercises that men need to do? Are they similar to the ones that the women do?
very similar. Absolutely. I mean, so really it's all the same musculature. It's the same nerve innervation. The only difference is the genitalia, right? But everything else is the same. So yeah, it's very similar. So all the treatment is quite the same.
Yeah, terrific. Jamie says, what about burning during intercourse post-menopause?
So with menopause and burning, we want to rule out if what the cause is. And again, usually it's multifactorial. So number one, it could be hormonally related, right? So, or hormonally mediated. So it could be estrogen, and not just estrogen, but testosterone, because if we take a look, sorry guys, but here's the female anatomy. So if we have our vulva right through here, and we have our labia minora, and we go right inside, and we have something called the vestibule, which surrounds both the vaginal opening, the urethral opening. That is both dependent on estrogen and testosterone. And when those drop, you can have burning in that area. So a pelvic PT will do a very specific test, a Q-tip test, a neurosensory Q-tip test, to see if that is part of the burning dysfunction. And then the muscles that sit right in front of that and right behind that can also be so tight that they create burning. And then the third option, actually, truly, with anyone that has burning with sex or vulvar burning, is a nerve problem. So you want your pelvic floor PT to rule that out as well.
That's great. This is a really important question from Gina. And this is one of the reasons we did the GI Health Summit, because people were so embarrassed about talking about pooping, even though every professional, they're not embarrassed. But she says, what would they say to a patient that is too shy to talk about personal parts to make them comfortable?
Yeah, so it's something we do get a lot. We have a lot of patients from a lot of different backgrounds, culturally, religiously. And so it's something that we're going to approach, and we want to meet you at your level, right? If you're at one level and we're trying to talk at a different level, we're not meeting. And so we want to really meet you at your level, and then try to educate you and bring awareness of why we need to talk about a little bit more of the structures and what they do. So that way you have a better understanding of how your body functions, and then a better understanding of how you can help in your case and help on your healing journey.
I think that's beautiful. And I always bring it back to guess what? This is anatomy, right? It's anatomy. So then hopefully it takes some of the taboo or like the quote, just weirdness or whatever out of it, right? It's just, even when we do an internal exam, I'm like, it's just muscle. We're going into muscle and palpating muscle, right? And I think when people wrap their head around it, and then they understand, and then they start to really see and put the pieces of the puzzle together, then they're very empowered. So I think we have a lot we've come really far with, at least now, because I've been doing this for over 20 years, and it was so taboo back then, right? And people are like, you do what? And now it is becoming standard of care. So I just encourage, to, if it is hard to discuss it, then write it down. You can communicate. We have an intake form that we ask some very personal questions on. And if somebody's not comfortable verbalizing it, they can write it to us. So, and respecting, again, like Mandy said, what their comfort level is.
Great. JL says, how common are these types of therapists? Can you find one in most cities?
In the major cities, yes. In the rural areas, you may have to travel, an hour. I mean, I'm from a very rural area originally. Thankfully, they do have, one of my classmates is a pelvic floor physical therapist there, but prior to her, I mean, you were driving at least an hour. In other areas, when we've done telehealth with patients, it may be 2, 3, 4 hours. But if you're in a major city or around a major city, you should be able to find a pelvic floor physical therapist.
Great. Dean says, I have prolapsing internal hemorrhoids with rectal tissue that comes out. Is there a way to reverse this condition without surgery?
Yes. Yes, absolutely. So pelvic PT would be your answer. So go and find somebody, have them do an assessment and start to learn how to contract your pelvic floor. Again, if it's shortened, you need to lengthen it first and then strengthen it and then integrate, because it's not just about Kegels. It's never as simple as that, right? Integrate that with your other inner core muscles. Let's look at gravity. Let's not keep you on a table flat, just trying to fire off a million Kegels. That doesn't work, right? Let's put you upright. Let's mimic what happens in life. And so that's some of the training that we do with our patients is, there's a whole progression with their program, but yeah, get to a pelvic PT and then that can be helped. Even if you end up having surgery, I'm like, it's win-win no matter what, right? Because you're going to prehab and be stronger than for surgery and the tissues will be healthier.
Great. Some people tuned in late and they were saying they can't find a lubricant that doesn't sting, but you said they can use coconut oil, olive oil. You recommended slippery stuff, so they can watch from the beginning. And Noreen says, what exercises do you do when you have pudendal neuralgia?
Such a good question. And go see our Instagram post today. We just literally posted this like 2 hours ago. We're going to do a series of different stretches if you have pudendal neuralgia. We have a lot of information on our website, which is pelvichealing.com, and then on our blog too. Every PN patient, so this is the main nerve that innervates the pelvis, and this is a very difficult pain syndrome to treat, but we have successfully treated this in our practice. And we have a lot of patients that make it to the other side. I always say the internet is a blessing and curse because there's some horror stories out about that diagnosis. But yeah, hop on over and you're going to see, instead of me describing it right now, just go. It's there. The pictures are there.
Okay. Karen says our doctors, Mandy and Julie, in the same office in Tustin.
Yes, we are.
That's great.
She makes my world better.
This is a very, we have a veterinarian watching, and she says that animals do get a lot of these things. Post birth. So yeah.
Yeah.
So glad I don't.
You're sharing.
I'm for spaying and neutering because there's so much pet overpopulation. So at least, Bailey's not going to have any babies. That's all I can say. So here's a really good question. It was about, yes, I can't find it though. It was about, sorry. Well, I'll go to this one first since I can't find the really good one that I wanted to ask, but not that this one isn't good, but from Catherine. How do you feel about colonics? Do they have a positive or negative pelvic impact?
That's a great question too. So I've had a lot of patients who have done colonics over the years with varying results. So you need to be careful if you go into a colonic and you have that pelvic floor muscle spasticity or, the spasm we talked about, the colonic can then later create a flare with that. On the flip side, it is a great way to detox. It is a great way to eliminate if you have tried everything else and it does not work. So in the GI Summit, like Mandy and I taught how to do a really good colon massage the right way. You look at diet changes, all these other techniques. And if that's not enough, I think colonics then serves a time and a place, or, can be a good adjunct. You just use caution for those who have pelvic floor muscle dysfunction.
Yeah. Somebody's asking what your Instagram is. It's at Pelvic Healing. I just went there.
At Pelvic Healing. Yes. And
you're right. You did post about that exact condition today. What are the chances?
Yeah, I know.
We were ready.
Where is, this is the question. Donna says, what should you do to maintain pelvic health as you age?
Great question.
Yeah, so again, I don't want to bring it back to what Julie said earlier about, we all go to the dentist twice a year, but we should all be having our check-ins with our both our, pelvic floor physical therapists, our ortho physical therapists. We need to be making sure we want to prevent these issues, I
Not
find
chase
we're
them.
we wait till we have a major problem and then we seek treatment versus preventative care, or at the first sign of something being wrong. At that point, get into your doctor, call your physical therapist, get it addressed before it becomes a major issue.
So one of the things, I mean, that happens is that the body will start talking to us, right? So perfect world, you're ahead of it, right? You're out, like Mandy said, you just go. But when the dysfunction starts to happen, is the body starts to, I always say, it starts to whisper, and then it's up to us to listen. And a lot of us will be like, I don't have time for that. It's really not important. It'll go away. So then the body really starts talking. And if we still don't listen, it will start screaming at us. And that's when our symptomology, whether it's pain, right? Pain with sex, constipation, whatever it is, is now just trying to get our attention until we do something. But at that point, right now, all this dysfunction has set in. So it'd be so much easier if you just go early for preventive.
Well, even though your shirts say, what do your shirts say exactly?
Yes, adore your pelvic floor.
And I would say we need one that says, don't ignore your pelvic floor.
That's
brilliant.
Yeah.
Because that's what a lot of people are doing, and they end up with these things. So this has been so fun. I hope I have another summit one day just so I can have you guys back, because you are just like wonderful. I just wish you were closer. You're 2 hours away. So from me, I would go.
It's not bad, Chef AJ.
It's not bad, but you tried with me then. Yeah, absolutely. So we have everything in the show notes. Definitely follow them on Instagram. And thank you guys so much for watching another episode of Chef AJ Live. We have 2 great shows tomorrow. At 11 a.m., we have Tracy McWhorter back, and she's going to be joined by her mother, because you guys wanted to see her mother, who also eats like she does and is beautiful. And at 2 p.m., we're having a cooking demo with Audrey Dunham. She has a new cookbook called Vegan Christmas Cookies and Cocoa, and she's going to be making macaroons that are chocolate dipped, and they're going to be amazing. Thanks again, Mandy and Julie. You guys are the best.
Thank you, Chef
AJ.
All right, take care.
Okay, bye.